This is Jacqueline Harris, physician owner of Desert Direct Primary Care. My family has health insurance through the small business that my husband owns. He pays a small fortune for this insurance, though, so we are always eager to learn better ways to give his employees and their families access to great medical care.
Hi, this is Dr. Joanne Beltry from WonderCare Pediatrics. I just opened last month and I'm busy trying to recruit patients. But I'm very fortunate that my husband works for our state university, and so we have very good health insurance through him. Before I left my urgent care practice, I was able to transfer over other benefits like my 401k and life insurance into a private benefit fund. So I was able to make a clean break with my salaried practice and have my benefits in other ways.
So what do you do for your family's health coverage? If you've ever wondered how other DPC doctors handle insurance or health shares, check out the latest issue of the toolkit from My DPC Story at mydpcstory.com/magazine. Direct primary care is an innovative, alternative path to insurance-driven healthcare. Typically, a patient pays their doctor a low monthly membership and, in return, builds a lasting relationship with their doctor and has their doctor available at their fingertips. Welcome to the My DPC Story podcast, where each week you will hear the ever-so-relatable stories shared by physicians who have chosen to practice medicine in their individual communities through the direct primary care model. I'm your host, Marielle Concepcion, family physician, DPC owner, and former fee-for-service doctor. I hope you enjoy today's episode and come away feeling inspired about the future of patient care, direct primary care.
You can do this. No doubt in my mind, you can do this. Will it be easy? No. You're going to have doubt, and it's going to be challenging, and you're going to have to troubleshoot. You might have to make some sacrifices along the way, but you can absolutely do this. You made it through medical school. You made it through residency. You may have made it through fellowship. You are a smart, capable individual. And I would encourage everybody to just really hone in on their internal fortitude that perhaps has been quieted down, whipped out of them perhaps because of the demands on the system. I would encourage everybody to dig down inside to their sense of purpose. I really strongly believe that we are all, no matter what you do, you can be a CEO, you can be a janitor, doesn't matter. If you're doing your job well, honorably, honestly, you are contributing to the world in ways that we might not even understand, right? Like it's that ripple effect. Your patients need you. Your community needs you. You can't pour from an empty cup. You will be a better doctor because of it. So absolutely find that roar within you. You can do this. No doubt in my mind. Anybody can. We all have to lean into our own strengths, delegate what is not our strengths, but you have something to bring to the table. Everybody does. You absolutely can do this. I'm Dr. Maria Rutmann of Lionheart Direct Primary Care, and this is my DPC story.
Dr. Maria Rutmann was born in Venezuela and completed her medical education at the Central University of Venezuela, or UCV, in 2011, and pediatric residency at Miami Children's Hospital, now Nicholas Children's Hospital, in 2014. After residency, Dr. Rutmann made the beautiful state of Maine her home, quickly falling in love with the peacefulness of the county and its kind, hardworking, tightly knit community. Also falling in love with one Mainer in particular, her husband, Lee Smith. As a mother of 2 young children, she understands the challenges that come with raising happy, healthy children and treats each of her patients as if they were her own. Outside of her medical practice, Dr. Rutmann is an avid scuba diver, swimmer, and nonfiction reader. She has an interest in interior design and is currently learning German and has the cutest clinic doors known to mankind. Welcome to the podcast, Dr. Rutmann.
Hi, Marielle. Thank you for having me.
This is such a treat. It was so awesome meeting you for the first time in person in New Orleans. And then it was such an even bigger treat when we got to meet each other again in Maine for dinner. So this is such a treat. And it's just a call out there to people. If there are DPC doctors around you, or if you're going to be flying somewhere where there's DPC doctors around you, call people up. It's just so wonderful, especially this time of year, to be around family and be around people who are supportive and people who are like, oh my gosh, guess what I did in my clinic? And it just makes you so excited to hear other people's stories. So, getting into Dr. Rutmann's story, I would love if you could start us off with, where do you live? Because when I said in your bio, the county, as a Californian, I had no idea what that meant. And then I learned about it when you and Doctors Lucas were telling me about what the county is in the state of Maine.
So I'm in northern Maine, the northernmost part of the continental US. I'm not from there. I married a county boy, so it's home now. But I grew up in Venezuela, so it's a big change. I've lived in Miami, I've lived in New York, and I feel like I keep going up north, and I'm going to end up there in the North Pole with Santa.
Good time of year for that, though. So, oh my gosh.
Yeah, I mean, well, we're used to the snow and the cold, so just bring it, right?
Yeah. And in terms of Maine, just for clarity for the audience, especially if you're me and you're state centric on your geography and that's not the state of Maine. Maine is freaking huge. Can you
It's
tell us
massive.
about how huge it is? Because I was like, what? It's New England. What are you talking about? So you guys were educating me on the state of Maine. And so I really want to set the scene for what the state is like. And then let's talk about access to healthcare.
Yeah, so Maine is massive. People think of it as a very small state, but actually, driving from Portland, for example, downstate to where I am, it's a good 4.5 hour drive. And I still have about an hour and a half north beyond where I am to reach Canada. But, healthcare is a bit of a desert here in a way. So my town in Presque Isle, we serve, I don't even know, but it's a huge radius. I have patients that will drive down an hour and a half to see me, and same with people that are like an hour and a half south of where I am. The closest, like biggest center that I have as a referral center is Bangor, and that's smack in the middle of the state, and that's a 2.5 hour drive.
Something I want to call out here too is that you are a DPC pediatrician in particular. And we're at a time when DPC, I have said this throughout the whole like existence of my DPC story, but we are always at a time where DPC is wanted and needed. And even in Presque Isle, talk to us about your pediatric population, because like here in Arnold, we're an hour and a half from the nearest NICU. But like I think about every time I go to a school production, I'm like, there's a lot of kids up here. There's like multiple elementaries, not as many as Sacramento, but there's multiple elementaries. And I think about not all of these kids are part of the practice yet. Like, where are they going for healthcare after January? So for your population, being within 4 hours of both Bangor and Portland, I'm just wondering, what do patients have to access in between all of those spaces?
It's been certainly challenging. So I've been in the area for approximately 8 years. And in the time that I've been here, I've seen many smaller practices in surrounding towns close. So right now, we're basically down to two decent sized groups, my old group and the two bigger hospitals in the area, I guess. And that particular group has survived over the years primarily with locumses. So it is very challenging, but precisely because of that, I saw an opportunity. Because, like you said, where are these kids going to go, right? And there's no alternatives. Like DPC, I believe is a fantastic option, but it might not be the option for everybody, and that's okay. But families can choose when there's diversity of options.
Absolutely. And we will definitely get into the personalization of your practice and your delivery of care to your patients. But I think about that is so true. It's not for everybody, but for the people who have joined on your practice, I am so glad that they probably have a completely different outlook on what healthcare access is now. And I'm wondering if you can give us some examples of comments you've heard from families about DPC is, I won't go back because Dr. Rutmann did this for me, or as a member of Lionheart, I experienced this.
It's been a wild ride. It's been so rewarding and fulfilling to see people receive it so well. So many stories come to mind, but here's what fuels me is that being a small community, I know the bulk of my families. These are not strangers that I'm seeing, right? They are my kids' classmates. They are kids of friends of mine. They are my baggers at the grocery store. So providing a certain level of care it really is almost like a duty to me. It really fuels a different level of purpose for me, because you're not in a big city. It's not anonymous. These are people that I'm seeing all the time, right? So I really just want to do the very best that I can for them. So, for example, simple things, simple stories, so many come to mind. I think people are really, really valuing the convenience. So I had a mom that was blown away. This was a couple of days after opening, because she got up at 5 a.m. The kid had been coughing the whole night. She decides, oh, I'm going to take him in. Suddenly she remembers, oh, there's an app. So she just self-scheduled an appointment. I saw the kiddo by the time it was like 9:30. They had an antibiotic at hand by 10, and out they went out the door. And they had a really busy weekend coming up. So she was like, this would have been a whole ordeal in traditional practices, because now you're calling, being placed on hold. Sometimes you get the busy signal, they don't call you back. And sometimes you waste a full day just trying to get an appointment. And this is a busy mom. Like, she works a full-time job. So she was super appreciative of that. I've also had situations of like after hours stuff that we can troubleshoot via text, and people don't have to go to the walk-in clinic. Simple things like colds, or bigger things like I've already sutured and glued and stapled kiddos. And again, they're not waiting 3 hours in an ER and getting a hefty bill. So families are absolutely loving it, particularly the convenience and the ability to text me for anything.
Amazing. And I'm laughing a little bit here because having seen your practice go from supplies in your garage to, what it is now, I'm like, yes, she used those staple removers. It's so good. But I want to ask here, because of you not necessarily not being born and raised in Maine, but being born and raised in Venezuela, and then going to Miami, and then going up north, as you described, also Santa, like if you need a remote DPC, I'm sure you can get in with Dr. Rutmann. But I think about, what is it that drew you to the county? Because I think about, there's people who are like, I don't ever see myself practicing in rural America, especially if like you've seen places like Miami. So I'm wondering, what was it for you that drew you to this community that you are a part of and that you are serving with your practice now?
People are just incredible here. They're kind. They watch each other's back. They're hardworking and honest. And I've never seen anything like it. Again, I've always been a city girl. So this sense of like, we got each other's back is really incredible. I remember when I was pregnant with my son, so many folks dropped off meals, and people that I knew, but I wouldn't have expected that level of dedication. Or for example, here, there's a lot of farmers too. And this summer there was a gentleman whose combine caught fire. And within minutes, you had other farmers in the area. This one cleared this, and that one brought whatever the heck tractor. I don't know much about it. It's like a foreign language to me. I'm still learning. But the point is that they pulled together, they contained the fire, and were a significant help to the fire rescue responder crew that was there. And it's just really inspiring. But from a medical standpoint too, I just love that in rural settings, you are just forced to do more for the patient. And I like that challenge, because you have to be cognizant that for any little specialist is a 2.5, 4-hour drive for a patient. So I think we get to practice richer medicine in rural settings.
That's so beautiful. I love that. And I feel it's another t-shirt that needs to be made, that the rural medicine is richer. I love that. When you were in Venezuela, when you were in medical school, did you always want to be a pediatrician?
Honestly, no. I'm so scattered. I have many, many interests. I think my first love was surgery, but here's the problem. I don't bounce out of bed at 5 a.m. like my husband does. So very quickly, I realized that as much as I liked surgery, it was not going to be conducive to a healthy lifestyle for me. But I had lots of interests. I was the kind of student that went through every rotation, just really, really liking everything. I fell in love actually with pediatric cardiology before I fell in love with pediatrics. Now, I've always worked with kids. I was a summer camp counselor. I taught swimming lessons and all the things. Like, I've always loved kids and how funny and how they surprise you with the most random comments, and you just chuckle the whole day after you see them, right? But no, pediatrics actually, I did it wanting to pursue pediatric cardiology originally.
Was it pediatric cardiology in particular that drew you to the Miami program, which is now Nicholas Children's Hospital?
Correct. I did, what was it, about a year and a half worth of an observership there with the cardiology team, they were nothing but welcoming and amazing and supportive. I will forever be thankful to all my attendings there and the nurses and the fellows that I worked with. It was just an incredible experience. But I was there for about a year and a half while I was in parallel taking like my steps and stuff before I got into residency. So it was amazing.
Stay with us. We'll be right back. Coming up November 25th at 12 p.m. Pacific, join My DPC Story and the DPC Coalition for a live Q&A on the Big Beautiful Bill, Direct Primary Care, and HSAs. We'll break down what this landmark legislation and H.R. 1 mean for the future of DPC, and you'll have a chance to ask your questions directly to those helping drive change in Washington, D.C. So don't miss out. Register today at dpcare.org. That's dpcare.org. When you were in Miami, I can just imagine that even though there's a lot of specialists, having a big center, you're probably going to do a lot, especially in the world of pediatrics. And even, yes, cardiology, absolutely, like you're mentioning, but just the amount of specialists that are there, you get exposure to a lot of things that you might have interest in as well. So I'm just wondering about when you went through residency, what did you have the goal of leaving Miami, and did that change how you approached which attendings you would rotate more with, or which rotations did you set specifically for your externships? I think about Dr. Lauren Hughes saying how she knew that she was going to go into her own practice after, so she intentionally networked with attendings differently, knowing that she would want to connect with these people after, but she would also want to work her patients up as well as they would before contacting them after she opened her own practice. So I'm just wondering, what was your experience in terms of designing your residency to be able to be an attending after?
Oh my goodness, there's a lot of layers to that question because I'll be perfectly honest, I shifted gears multiple times while I was in training. So I went in completely 100% passionate about cardiology. In pediatrics, pediatric cardiology is a second-year match. And I had gone to a couple of conferences and met with a few fellows, and I realized very quickly that it was not only competitive to get to, but more concerningly, it was very hard to land a job after training. And I got a serious amount of cold feet to the point that I withdrew from the match. And then I was like, well, in parallel, I was doing PICU and I fell in love with PICU. I had very little exposure to PICU as a medical student in Venezuela. So this was just like, oh my gosh, this is amazing. I can do CICU and I'll just pivot and do that. And then third year came around and that's when the PICU match happened. And for personal reasons at the time, I kind of shot myself in the foot a little bit and only applied to a couple of programs and didn't get in. And this still stinks to date, but you know what? I don't mind sharing it because sometimes in life, not sometimes actually, oftentimes in life, the magic happens in our hardest moments. So it was in third year residency that because I didn't get into ICU, I shifted gears and I said, well, I'll just do primary care. At the time I was on a J1 visa. I'm like, it's going to work out. I was single. I didn't have kids at the time. I'm like, I'll just save money. I'll go somewhere rural where I can get rid of my waiver requirement and also get to practice, like, again, richer medicine. And then once I get that out of the way, I'll go back into fellowship. And it was a complete leap of faith to coming to Maine. I didn't know a soul. I loved the group that I was with. And I just felt a pull in my heart to come here because I just felt at ease here. I kind of wanted to experience 4 seasons and something different than Miami. Financially, it makes sense too, again, because I wasn't in an expensive city and saving was a goal of mine. But fast forward, this was at a point in my life that I was like, I am done dating. Like, I'm so done. This is just not for me. And I was totally at peace with the fact that it was just going to be me and my golden retrievers because I'm not a cat lady. And what ended up happening is that a week after I moved here, I met my husband. And 4 months later, he's proposing. And I will take that, what felt, I guess, at the time as a failure of not getting into ICU any day because God flipped it. And it has now been the biggest blessing because I would not have my husband and my kids and this practice and all the life that we've built here in the last 8 years had it not been for that. So it still hurts a little bit, but I'm thankful. It was a blessing.
I'm so grateful that you shared that. But also I think about how, you talk about the match, and we're all familiar with people in our classes, friends that we know who had to scramble. But I think about even in this time in medicine, people are losing their jobs, just like my husband was replaced by a non-physician model. So I think it's so great that you shared, because just that the idea of when stuff hits the fan and you're like, this is the worst ever, but it's, as you shared, the present, it's like the past 8 years have been only because this really like heart, like this thing that hurts still to this day happened. But without that happening, you couldn't have had what you have now. And I think that I say that especially to those doctors who may have been replaced by a nurse practitioner, may have been told that like their job's getting eliminated because of lack of funding or whatever it is. But just know that like you're still doctor, whatever your last name is, and that doesn't change whether you're employed or not. And I will say that it sounds a little Pollyannish to just like echo what you said, and it wouldn't have happened. Your life wouldn't have happened had that not happened. But I am with you in that things happen for a reason. And if it sucks so bad that you're like, I don't know how to get out of this mind space of I don't see the purpose in what just happened to me. If you feel devalued, please call a DPC doctor who is near you in another state, practicing in the same specialty, just because we can see things on the other side that we couldn't when we're in the thick of it. And so if you are
100%.
listening, if you are listening, you are so valued. And I think that is so necessary to hear in this time where PE and VC are really impacting healthcare continually, even, I mean, to the point now where especially kids and people on Medicaid and Medi-Cal are going to be suffering. So with that, I want to ask you about then your experience with your group, because your group definitely was a fee for service group, but I'm wondering if you could tell us your experience there, and what was it that made you transition into Lionheart DPC?
So my group was really phenomenal. The whole time that I was there, I really enjoyed it. So I was in a group of 6, for service, hospital-based, inpatient, outpatient model. The group was always fantastic. You had different personalities and different styles, but at the end of the day, everybody would kind of get to the same conclusion and outcome. So clinically, we all trusted each other, and parents just kind of gravitated to whoever they felt the most comfortable with. And it always worked out great. My issue has never been the group, but the reality is that the job changed and morphed quite a bit, and in the 8 years that I was here. And it kind of reminds me of that story of if you put a frog in boiling water, it jumps out, but if you put it in lukewarm water and you gradually turn up the temperature, eventually it doesn't jump out and eventually it dies, kind of thing. That's I felt like kind of was happening with how medicine was changing, and not just because of my hospital, but that's just the landscape of medicine currently. But I just felt like we were losing autonomy in basic things like scheduling. Appointments were getting shorter. We were seeing down the pipeline people retiring or needing to grow the practice again. I mentioned that a few other practices in the area were closing, and recruitment was just extraordinarily difficult. So all of it compounded. My hospital also went through a big merger a few years after I came. Then you had the pandemic, and I mean, the temperature was just rising really quickly for me. And I think it boiled down to, yes, moral injury, but largely because as physicians, we have all the responsibility and none of the autonomy. So you can't practice that way. Like, you got to give me some level of leeway to say, hey, I need more time with this patient, or this process isn't working, or this metric doesn't make sense. Why are we chasing this? Or, okay, I understand that we have to chase it for financial reasons. However, we're doing the work and not getting it credited. So can we fix whatever's happening in the background? And it gets exhausting to work that way.
Stay with us. We'll be right back. If you're looking for tools and guidance for your DPC journey, check out the resources page at mydpcstory.com. You'll find our Start Here guide, links to upcoming conferences, our Substack newsletter, and so much more, all curated to help you succeed in direct primary care. And I'm just wondering, because that's another beautiful statement, we have all the responsibility, but not the autonomy to achieve that. What were some of the things that you tried to make changes in your group, especially because you just explained that there was a merger that had happened? Because I'm wondering if there was an example of how the autonomy became even less after the merger.
Yes, for sure. So when I came here, our rural hospital was kind of its own little thing. I remember interviewing with the CEO, and after the merger, everything was getting dictated by downstate in an effort to standardize and consolidate. And I mean, I understand it from a business perspective, but you have to also, from a business standpoint, understand that the county is a very different thing than Eastern Maine Medical Center in Bangor. And so I wouldn't say that it was just me. I feel like our group as a whole, we were really trying to convey, like, we need access. If you don't want our patients to end up at the walk-in clinic or in the ER, plugging up an 8-bed ER that's staffed with one physician at nighttime, we need to be able to fit people in the same day. And that was just getting harder to do, again, for a mix of things: administration requirements and managing higher volumes and shorter visits, et cetera. So it's just not one thing, right? It's all of it.
Absolutely. And as you described the temperature getting hotter, at what point did you say, this is not the way that I can continue going forward in my medical career?
Well, I can't look back at one particular instance, but in general, it was a feel of, this is bleeding into my home life. I was coming home feeling like mashed potatoes. I have 2 toddlers, and I was just like sitting on the couch there, just like, I don't even have the energy to play right now. Dinner? What? I have to make dinner? I was just like not functional at home. And I am generally a pretty upbeat, positive person. I don't consider myself to be especially moody. And I found myself just like borderline depressed. And it was when day after day, my husband would come in, hey, how was your day? And I'm like, well, kind of like Eeyore. I'm like, he's going to start hating me. What is happening? That's on the personal side. On the patient side, or the practice side, I think what really broke me was when we went to all 20-minute appointments, with the exception of 3 for the day, which honestly, at that point, you're running so behind and you got so much inbox work to do that it's all the same. But in parallel with, they took away our scribes. So that was just a punch in the gut, because how do you do more with less constantly, right?
Yeah. Yeah. And that's so real. And I'm guessing that the listeners are translating that into their own experience, what they've seen and been through in their own practices. Like, how do you do more with less time, less resources? That's so ridiculous. When you talk about the scribes being taken away, I think about that in the hospital when we were practicing in fee-for-service, the hospital provided scribes and billers and coders, but for the outpatient doctors, if you would like that, absolutely you can have it. You have to pay for it yourself. But if you're a hospital doctor, then we'll help you out. It's so ridiculous. And especially when we think about what you and I are doing now, in that it's totally opposite of the way that our practices have been created and built and the way that we're flourishing now. When you were in this place of, I'm feeling work and affecting home life, the practice itself is just not tenable to the quality of care I want to deliver. How did you start learning about other ways of practicing, and how do you heard about DPC first, or were you ever thinking about your own private practice in fee for service?
Well, for starters, I might choke up here because this is amazing. It was you. It was because of you, and never in my wildest dreams had you asked me a year ago would I've ever imagined that I was going to be sharing my story on my DPC story. Because it was actually my husband, who's very much an outside of the box thinker. He found your podcast and he sent a link to me and he said, "Hey, check this out. Have you heard about DPC?" And I hadn't, to be honest, or at least not like really tried to wrap my head around the model. And I think I said this to you when we met, but this is really full circle, but it was you. And the episode was so compelling. And I remember just reading a little bit online after that. And then fast forward, what I did is I took a few days off for staycation, and I bought the on-demand DPC Summit from 2024. And I just sat there with my computer for a few days and did the whole conference right at my living room. And I think it was like 3 or 4 days maybe. And then by the end of it, I was like, I'm doing this. I'm doing this. There's no question this is happening. And this was back in October 2024. And so from October through, let's see, like February, March, I was just like planning. And then after work every day, I would just chip away, start it with buy the domain and pick a name and get a logo and meet with the lawyer, set up the business and get a fax number and all the little things. And finally gave my resignation letter. What was it? I think it was February in the hospital. I got done in May. And all through the summer, I just worked full time in the clinic. So our space, I absolutely love it. I poured my heart and soul into it. I love interior design, and I really wanted a space that conveyed a sense of peace, a sense of welcome, that people would walk in and immediately like their blood pressure would lower. And I think we've achieved that. It's very rewarding, but it was a complete gut job. I mean, this place was a mess. And mind you, in rural Maine, there's not a whole lot of commercial options. So this was a complete gut job. And so during the summer, I basically GC'd the project, which I'm thankful that I had the luxury to take that time off, both for the practical needs of GCing the job, but also because I really needed to heal. It was so amazing to just spend the summer with my kids and feel human again. And I think as physicians, we are wired to pour into others constantly. We're not very good about taking care of each other or ourselves. And that was really eye-opening to me. I guess I hadn't realized how stressed, how flat, how numb I was until I don't mean to sound dramatic, but I felt like coming back to life and being myself again during the summer. And we opened in September.
Beautiful. And I just think about, and I'm also cheating because I can see you as we're talking, but it's like you have a picture of a lion behind you. And I just, knowing that your practice is Lionheart DPC, and yes, I worked at a zoo for 8 years, so I can technically hear John the lion, like doing his thing in the morning and shouting, but I mean, you recognized where you were, you recognized that mashed potatoes is not a great feeling to be feeling when you go home. And you just went at it when it comes to watching these summit recordings, listening to podcasts, connecting with people. And so Lionheart, just from your story, is so representative. It's so, I'm just going to keep going. I'm going to roar and go do what I need to do and be me. But I'm wondering at what point did you choose that name? And because I'm thinking with other people out there, you don't have to have my name at medical clinic or whatever. It's like you can have the autonomy even with the branding and the naming of your practice. So how did you choose Lionheart?
Well, I'm glad you asked because I love the name. So it's multiple layers. So I'm Christian, and it was really so I started out trying to figure out names, something related to Maine, and I was coming up with nothing. Couldn't really land one that I was in love. And I remember that afternoon I'm just going to think about something else. And I sat down to do my Bible study, and suddenly it was like lion. I'm like, lion. Yes, lion. Lionheart, this is perfect. I don't know. I started brainstorming, but to backtrack a little bit, it resonated with me because the lion symbolizes courage. And I think I needed that at the time to step into a different model, but patients also needed to step into a different model themselves. I am inspired by lions, how in the wild, like they're very strategic together. When they hunt, for example, they take care of the young together. They're a community-based animal. And that's, again, something that resonated with me because that's what I'm trying to build within the clinic is community and trust and partnership. There's also a little story is that, for example, one of my very first patients in the area, he was about 2 when I started seeing him. And I remember checking his ears and I was like, hey, there's a little lion in here. And he got the biggest kick out of that. And he is now 10 years old. And that young man, every time that I see him, every time, Marielle, he asks, is the lion still in there? Is the lion still in there? So to me, the lion
So
also,
precious.
yes, it was just representative of that relationship built over years and that trust. And I've had this particular family, I can think of many things that we've gone through. The trust was just a key component of the outcome. And so the lion symbolized all of these things, but first and foremost, just faith and praying for courage to do something different and do it well and trust that there's a bigger purpose for it. And I found it in DPC because I can take care of my patients better. I really can provide better, wholesome care for people in a way that it's just impossible in fee-for-service.
Incredible. And I will call out here that courage very much manifested in the best business cards ever. And which I still have yours. It is Dr. Rutmann gives me her business card and this is a thick business card. It's like super professional. And like you hadn't even finished gutting your clinic. You still had your stuff in the garage. But I want to ask here, like, why a business card? Why did you make the business card like you did? Because you didn't have your doors open yet. But it was still okay to have a business card and start making claim to your future.
Yeah, that's so funny. So the practicality of the business card itself was a recommendation from a good friend of ours who's a very successful real estate agent. And she was like, get the thickest ones that you can get because people feel bad throwing them away. I love Jane. She was actually the one that introduced me and my husband. So she's pretty amazing. But then as far as, yeah, I wasn't ready, but I was ready. Like it was happening. And I think sometimes we tend to focus so much on the finish line that we discredit all that we're accomplishing along the way. And in my heart, even though things were still in the garage, I could see it clear as day in my heart and in my mind. Like to the littlest detail, like where I have like stickers on my reception area and the exam rooms, it was in my heart and in my mind. It was so clear. So it was just, yeah, that little card was just symbolic of what was to come.
And it's so beautiful. And I hope that, especially for the listeners who are in this moment of whatever, but they're thinking about DPC or planning DPC, or even if you're going through rebranding, I will say that too. Like the idea that you just shared, that it's like you were ready, like that is not determined by if you have everything to this point open and you're ready to see your first patient in person in your physical space. You might not have a physical space, but like when you are, this is what I'm going to do in your head, you deserve to have a business card. You deserve to have your website. You deserve to have your social media handle. Those are things that are, it's healing for our souls in that we are literally in these things reclaiming autonomy that we should never have lost in medicine.
100%. And we are also tend to be very goal-oriented, result-driven folk. And going back to the business card is silly, but I remember when I finally got them after printing, I ordered them on Canva actually. And it was just a simple little business card, but it represented so much because at that point, the website was up and running. The fax number had been selected, which was linked to my EMR. So like my EMR was ready to go. I had a physical space. I had the logo. I had the business. I had my color scheme. I had pictures taken. I had open social media accounts, which I I don't love social media. That was a pain in the butt to put social media accounts and get them up and running. Like it was all these little things. And I felt so proud because it's like, I am making progress. I'm getting traction. It felt amazing.
Absolutely. And I've loved seeing progress in visual pictures like throughout your journey so far. But I have to now call out what I mentioned in your bio, the world's cutest stores ever, because you talk about community and you talk about having the sense of being together. I mean, to the point of even both parents and kids have their own doorways. Tell us more, please.
So when I started just daydreaming about the space, I really wanted it to be child friendly and have it just be fun. I thought about, oh, do I put like this fun little play area in the waiting room? And then, well, I got here, well, okay, the waiting room's a good size, but it's not that big, so I can't do that. And I remember checking on Pinterest and I saw this playroom with the doors. I was like, oh, wouldn't this be amazing? And I ended up connecting with a very, very talented gentleman who did the doors custom made here. And they're solid maple. They go perfectly with our design. But when I met with him the first time and I showed him the picture, I'm like, can you pull this off? So it's like a little 4-foot door inside the big door. And you could just see the creative spark in his eye. He was like, oh yeah, this is going to be fun. And immediately he's like clearing his desk, starting to draw stuff. So it was just really fun, but it was symbolic of, how do I say this? It was like just a visual representation of just having a space that's fun and for the kids. It's not the other way around. Oh, we're going to repurpose the space and I guess we'll throw pediatrics in there. No, I want my patients to feel at ease when they come here. And sure enough, when I had my open house and I had the first few patients come into the clinic and they went through the little doors, I teared up because the sense of joy in those kids' eyes, they've never seen anything like it. They were having so much fun. And now, like, they're not scared to come here. I had a good compliment from a mom not too long ago. I was actually taking care of a laceration for their little guy and he's hurt. He's like legitimately hurt. And the mom goes, he was bawling his little eyes out. And the minute that I said, we're going to see Maria, he stopped crying. He was looking forward to it. He was excited. I was like, that's amazing. That's perfect. That's exactly what I'm shooting for. Oh, and get this, you're going to love this because I'm all about like symbolism and stuff. So I went to pick up the color for the doors and the gentleman that was doing them, he goes, I can do lacquer. Just go to whatever hardware store and get any color, Sherwin-Williams, Benjamin Moore, I don't care, get whatever, I can do any. So I went over and they have the big wall with all the samples. And I'm like, oh, this dark teal, this is perfect. Teal's my favorite color. It's the color of our logo. I pulled it out. You want to know what the name of the color was? Venezuelan sea. I was like, this is perfect. This is meant to be.
Totally meant to be. That is awesome.
Yeah. So I don't know, just little things like that. Teeny tiny things, but it's just joy is just sprinkled all throughout the space. And I absolutely love it.
That's amazing. And I think about our kids are little in age, but I think about how even with Nolan, our youngest who just turned 5, I'll say he'll have some issue and I'll be like, would you like help with that? Or you got it. And usually it's, you got it, but it's, yes, the safety of you as the doctor, you who they're seeing, this personalized space, but just, I go back to the door because it's like, I can even open my own door to my doctor's appointment. Thank you, parent of mine. You can stay behind as I enter my own door. Like it is, I can see Nolan just like going nuts. So when we visit Presque Isle, I'm going to be like, we got to go check out the doors first. Oh my God.
100%, 100%. And in the same train of thought with when we did the remodel, the bathroom that the space had only had one sink. And in the remodel, we actually added a second sink and it's at a lower height, at the height of a child, precisely because of what you're saying, because it fuels a sense of independence. And as a parent, you want to nurture that, right? So I can think of many times that I picked up my daughter at whatever, a mall or something bathroom and, hey, you're squishing my belly and my sleeves are wet. And it's like this whole thing, right? But here the kids are like, oh, wow, I can do this. This is cool. And like the toilets, like I got like seats that have the little toddler potty training seat inside the seat and little things like that. The space is truly meant to be for them. I was also very intentional with the colors that I used throughout the clinic. Again, I said teal is my favorite color. But other than that, I really kept it with a very neutral, calming color scheme, precisely because kids are overstimulated nowadays. Parents are overstimulated. People are coming into the office, everybody's flapping. And again, I wanted it to be a grounding, calming space. And I think we've achieved that.
That's awesome. And in terms of the space itself, can you give us can you just give us a description of the visual layout? So if you enter the front door, what does your patient experience in terms of the waiting room that's not used for waiting and what is beyond there?
So the layout it's an L shaped. The shorter part of the L is more like staff office space. So I have a little break room. My office is there and a second bathroom where I also have a washer dryer to take care of like washing the gowns and stuff for the patients. But then the longer part of the L is the waiting room and then our exam rooms. You walk in kind of in the corner. The first thing that you see is the reception area where I'm sitting at. Another story about when we remodeled, the space actually had one of those little sliding windows because it used to be, I don't remember what business was here many years ago, but it had one of those windows, sorry. And I told the contractor, I'm like, can you take this out and fill it up and sheetrock over this? I don't want this. He said, you sure? But wouldn't that be useful? I'm like, no, I hate those. They're so impersonal. It's like an immediate barrier when you walk in to a doctor's office and people are on the phone and they slam the thing at you. I hate those. So I was very proud to rip that out of the space. So when you walk in, we have an open desk, and I think it immediately conveys that sense of we're at the same level. We are friends here. There's no division of you patient, me doctor, not at all. It's like we're in this together. But then we have 5 exam rooms. I know in my heart this is going to grow. I've only furnished 3 out of the 5, but yeah, it's been a wild ride and it's been fun.
And tell us, we've mentioned the garage a few times, but tell us about your strategy in knowing that like your clinic is happening. It's like, it's already in your head. What are some of the things that you look back now and you're like, I am so glad that I had these things because you're already open and treating patients?
Well, I'm just really proud that I had very few things. I was like, oh, I forgot that. It was really cool that because I had time, I was able to think from the bigger items to the little gritty, I need 2x2 gauze or whatever. I think my favorite tool so far has been the vision screener. It's expensive as I hesitated to buy it, but you know what? It's been remarkable because so nobody in the area has it. As pediatricians, we are big on prevention. And what you see with patients that develop lazy eyes and amblyopia and all of that is that a lot of kids can't complete a vision test until they're 4 or 5. And by that time, if there's an issue, it's well progressed. And oftentimes, if you're picking up earlier, it's because the kid has already developed the lazy eye on exam, right? So that to me was just the epitome of preventative care that doesn't happen in fee-for-service, because if you look up the reimbursement for a vision screen, it's like less than $10. So why would any hospital system, because they're all strapped for cash, would buy you a $10,000 piece of equipment? They're just not going to, right? But for me, it's with the way that our overhead works and because the numbers in DPC are different, I can do that. And I'm doing screens as early as 6 months. And I've already had a really good couple of pickups. And then you give the family a fighting chance to tackle this before it becomes an issue, right? Because it takes a while to get the kid used to wearing glasses, or it takes a while for the patching to actually work, or even for them to tolerate it. And then you get to, God forbid, the point of surgery, and the surgery is not always effective either. So talk about something with like permanent consequences that now I'm able to pick up because of this fantastic tool. So that's one that I love for sure.
I love that. And as you were thinking about it, I'm like, my snarky comment in my head was, and I'm saying it out loud, definitely not enough money to buy a vision screener, but definitely enough money to put your logo on an arena for sports like that, because that absolutely makes sense. But also on a more serious note, our DPC pediatrician, she comes to the home once a year and the boys are like, minus the shots, the boys are like, man, I'm so excited. We get to show we get our Lego set. Da, da, da. And then when that vision screener comes out, man, everyone needs to be quiet. We got to shut the lights off, guys. It's a big production by my
Mhm.
kids because that's how they're experiencing the doctor. And so I love that you're mentioning that, especially I think about this, we're both rural, but it's like the tools that we have, like we have an audiometer, I guess that's what it's called. Yeah, an audiometer. And I think about these are tools, yes, we can use for our members, but these are also tools you can use if you're doing, especially pediatric clinics, because we're talking pediatrics here. If you're doing community health fairs or whatnot, I mean, you already have these amazing tools. And usually because these tools are so like the modern day tools that we have, these are things that like you don't typically see in fee-for-service clinics a lot of time. So it's even one way of marketing your practice and how it's different than other practices. So I think it's a great tip. When it comes to you mentioning the person who was like, oh man, I'm so excited to do these doors for you. Do you have any tips also on working with the community in terms of having them come on to do projects for you? Because we've talked in the podcast before about, do you barter? Do you not barter? How do you approach it, given that some of these people could also be members as well?
I think it's a case by case basis, right? I was very blessed that literally every single contractor we worked with was extraordinarily talented and it was fun and I was here all the time. So I really got to know them. I know that a few are thinking about joining. I've had a couple that have already joined. And I think my advice for people would be don't just focus on the membership. Don't just focus on the money. Be a good person, do things right, be a kind human being. The money and the business will follow, honestly.
When it comes to opening day, your practice is ready with the doors, with the colors, with the welcoming environment that you've created. How was the community response? Because people, like you said, they already knew you as part of the community.
It was really positive and it was very, very exciting. I had businesses in town send flowers and friends and family that don't even have kids just stop in to say hello. And there were patients of mine that came in that hadn't seen over the summer. And with peds, like they changed so much, right? So it was just really cute to see. I had a couple of girls come here and do face painting for the open house. And I ordered some macaroons and cookies with the logo and stuff from a local business. So like we're just really trying to keep everything local. And a few teachers of my kids came by and I don't think I even have words to describe how fulfilling that day was. That just people cheering you on, people saying, well, I'm glad that you're doing this. I can see that this is going to be good for the community. I love having options. I love what you're providing. And families talking not just about care for their kids, but it led to really good conversations about insurance and care as a whole, right? So like it's almost my sense is that people are frustrated with the system, but they don't quite know what the options are. So it was great not just to do that for me as a practice and my pediatric patients, but for families and adults and businesses to start thinking outside the box.
It's so true. I literally just had a conversation with somebody whose doctor went to concierge medicine in Texas. And I was like, did they even know about DPC? So I think about when you talk about that people might not know that DPC exists. This is why I'm so grateful for now you not even just listening, but now sharing your story so other people can hear your story, because this is what matters in that we have representation as independent physicians who are in communities all over the nation. I mean, I was so excited to bring an example of Dr. Katie Burden Greer, who's practicing on reservation land. Like, amen. Rural doctors like you and myself, people who are like Dr. Natalie Gentili and Dr. Kirsten Lynn opening an MSO where there's billboards of people with Super Bowl ads and they're thriving. So there's so many examples of how DPC works, but knowing that DPC is a thing and that concierge medicine is different, these are such important facts to know about medicine as of today's world of medicine. I love that your community was so welcoming, but I'm wondering if you can talk to us about the conversations and how they went with people who were like, but I don't necessarily know what this is compared to your old practice with you taking insurance. So how did you talk to families about what you're doing, and has that changed? Because now we're in November, you opened in September, and I would assume that even just in that short time, your personalization of how you talk to parents has even changed.
Yes, you grow in confidence, I guess, to talk about it. And because I don't like coming across as salesy, right? I think we all struggle with that, but we also see the value of what we're offering. And I think you grow in that confidence to talk about it, not from a salesy angle, but just this is really cool and you need to check this out, right? But it's how do I say this? People have different needs. And I think what I'm finding is that I have a little bit of a melting pot of reasons why people join the practice. So I have the folks that value the convenience. I have the folks that value me because they trust me as their provider. And then I have folks that see the cost savings because they are uninsured or they're about ready to drop their insurance. And so I think my advice for folks would be to find what is motivating the other party and try and identify those barriers or the challenges that they're facing to have just a productive conversation, right? Don't just approach it from the elevator pitch sales angle, but just these are human beings. You are an alternative. Is this going to be a good fit? I think my favorite part of the conversation is when I tell people it covers all of your visits. The monthly membership covers all of your visits. And they look at me kind of funny. I'm like, yeah. And like to drive the point home, I'm like, doesn't matter if I see you one time that month or 7 because you had a terrible sinus infection. Like you don't pay a penny extra. And they're like, oh, wow. And then suddenly it's in perspective, right? Because I pay more for my phone than what my monthly membership fee is. A pedicure is 75, 85 bucks, depending on where you live. A massage is hundreds of dollars. So it really boils down to what people value, right? Some people, like I said, will value the convenience. Some people will value the savings. Some people value you. And I think they need to understand the value before they come on board.
I love that answer. And I ironically just came from dinner in Sacramento with a DPC doctor who's practicing in Elk Grove. And we were talking exactly about this. Like the way that I think of the pitch, so to speak, is very different than what I thought the pitch was like when I opened. And it's very much more of what you're describing right now. It's tell me about your access to healthcare. What are your biggest frustrations? They will tell you what they want to hear. And it's very common that when we think about marketing and you need multiple passes for a person to actually hear the message, that is changed. The number of passes needed is changed when they're telling you what they need up front. So I think that is really great. And I thought about this too, just on your website, when you have services listed, you have in-body scan, you have medical ear piercing, you have 4th trimester care. And I think that it just speaks to that you're doing this anyways, but also just the way that it's called out in different sections on your website. That might be what the person is starting to experience your clinic by, but that's not it. There's way more that goes beyond just those services.
Yes. And I have more in the pipeline because I think what I'm trying to identify is areas of need. And I love learning. I love a challenge. That's one of the things that over the past few years has been hard for me, is that every day look the same. I get bored easy. I'm too ADHD for it, right? So like I'm in the process of getting my lactation consultant certification, and I'm doing a course on doing tongue frenectomies for my tongue-tied babies. And just I would love somewhere down the line to incorporate allergy testing in a safe matter as well, because again, those are things that people are just waiting months and traveling far to get answers to. So that's been really interesting to incorporate. And I love the freedom to do it in terms of time, but also in terms of I don't have to ask any administration for permission of, hey, what do you think of me offering the service? I can just do it. I love that autonomy because I'm growing. And at the end of the day, the patients are going to benefit from it as well, instead of just cutting through administrative red tape.
And I think also for the listener who hasn't checked out your website yet, you even have a note that says, if you're needing a service, let me know what you're needing, because there's more services coming and I might be able to deliver that. I mean, it's almost like asking an open-ended question. It's like, there's not necessarily A, B, C, D, or E. There's no other. And it allows the community to think about, oh, I actually do need this service, but I haven't been able to find it anywhere else. So I think that's very lovely that you have that on your services page on your website.
Thank you.
Yeah.
Thank you.
Going into the next year, I'm wondering, because we were talking about just healthcare access in Maine and how it is being impacted already. But I'm wondering, what do you have on your plans for next year in terms of strategies that you're thinking about already that are already built out in your head? And what do you think about, and where are you when it comes to growth with another physician or another non-physician provider joining you? Because like you said, you expect it to grow. It's just a matter of taking it day by day, and that will happen.
Yeah. I think my goal, my dream, not necessarily with a concrete timeline, because I'm just trusting that it'll happen when it's meant to be, but I would like to bring in an adult provider. The amount of families that have told me, when is there going to be an option for us as the parents, is crazy. The access to care in the adult world is it's really heartbreaking up here. My dad, for example, not too long ago, he had an appointment. He's in his late 70s. The office had to reschedule him. It wasn't him that missed the appointment or anything like that. They pushed him out like 5 months. So I see a need, a true need, and I would like to be a part of the solution for people. So that's probably my biggest one. As far as marketing, I'm just trying to remain flexible, and we're all learning as we go. I don't think there's a cookie cutter way, but like one fun thing that I actually just solidified in the last week is that we have a junior hockey team in town. This is the first year that this team is playing. They're called the Northern Maine Pioneers. And I initially had approached the team to say, hi, hey, can I be of service to you somehow? Because, I mean, honestly, where are they going to go, right? Pediatrics is going to say, these young men are too old for us. They're not going to see them. Adult practice is going to be like, oh, yeah, we'll see you. Here's your appointment in April, right? And then walk-in clinic can't really handle concussions, or what if they're struggling with mental health because they're away from family? I mean, we got kids from halfway across the world, right? So I'm like, I think I can meet their need. So we put a little package together for them, and over time I've actually gotten to know quite a few of them, and they're really remarkable young men, and they embody what Lionheart is, right? Like, they're being courageous, they're being bold, they're pursuing their dreams, and I'm just like totally inspired and on fire by all of them. So I'm actually going to be their doctor for the whole team now for the season, and that was a complete curveball, right? 2 months ago, this wasn't even in my radar, and it just happened, and it feels right, and it's been fun. And it's helping me grow too, because now I'm taking care of these like really competitive athletes and younger adults, which is a little different than what I've done in the past. And again, it's just fueling that sense of purpose. I spoke to, or have spoken to, a few of their parents, and let me just say that their gratitude for, a peace of mind, I guess, for having somebody be there for their boys, who there might be men, but to the parents, they're still little boys. It's really sweet. It's really endearing. And that's why we went into medicine, right? To be good to people and do things right. And I needed that. I missed that. Does that make sense?
Absolutely. And a huge congratulations, because that is awesome. And I think that even the pairing of you described it as a curveball, but it's like you being in a moment where you could be open, and they needing a doctor who was open enough to take care of them in the manner that you can. Again, it's just things happen for a reason, and that's a beautiful pairing. And I know that they're just going to be experiencing healthcare so differently, and especially things like hockey and not soccer, hockey and football, the things that I'm like, oh my God, I hope you never play those kids of mine. But I would be so much more, I would be so less anxious as a parent if my kid had a DPC pediatrician like you. And that's why we have DPC pediatrician for our boys. So I think that's awesome.
Yeah, they've been a perfect example of the value of access, because there was one morning, for example, that I was dropping off my daughter at school, and I get a call from one of them and says, hey, I think I may be concussed. Can you see me today? I'm like, yeah, I'll see you at 10. Swing by the office. Easy, right? It was just so easy. Or I've already troubleshooted, not just with them, but with other families, so many things via text. But again, you're coming out of this place where there's a relationship, where there's trust, where communication is easy. It's instant, right? You're not going through playing phone tag, or what's that game? Like that you kind of sit next to each other and you pass along a message. By the time it makes it through the whole group, the message is completely different.
Yeah,
I feel like
telephone.
that happens.
Yeah.
Right. I feel like that happens in traditional practices because you're going through a couple of front staff members, maybe a couple of nurses or MAs and bouncing the message back and forth. It dilutes the situation. Not only does it create a delay in care. So, the value of having communication with your provider, with your doctor is just, I mean, in my mind, it's priceless. It's one of the things that I love the most about DPC.
What would you say to other DPC doctors who are not at this moment letting that Lionheart of their own out into the world and they might be quashing it?
So one of the things that I love the most about DPC is the time that it allows me with the patient. And I'm not just talking about like me not rushing through life. It's when I can actually get to the meat of things by listening to people in not just a 5-minute appointment. I can spare you from unnecessary referrals. We can tackle things better. We can tackle things efficiently. I remember I had a patient not too long ago that they had asthma and had seen multiple providers along the way. And when I spoke to the parent, they were like doing all the things right. Like they were on the right meds and like, why is your asthma still a disaster? It shouldn't be this way. Everybody's done the right thing. So it occurred to me, like, can you show me how you're using the inhaler? And they were using an air chamber and they were just kind of like spraying it to the kid's face and putting it down. And the kid was not effectively getting the medication. And that to me was just such an eye-opening, wow, like this is basic, right? Because nobody took the time to teach this family how to use the air chamber. That was a failure right there. Granted, there could have been miscommunications along the way. People sometimes leave overwhelmed. I'll give everybody involved grace, but it was just like, wow. So it's little things like that I think having time with your provider is crucial, but also, again, when we can tackle a lot without having to refer you. But it takes time, right? So it's just, for me, that's one of the biggest values in direct primary care for families.
So powerful. Well, thank you so much, Dr. Rutmann, for coming on and sharing your story.
Thank you, Marielle, for having me. This has
Awesome.
been wonderful, really. DPC, I think, saved my career. You hear that often. And thank you in particular for putting this out there because you are such a heavyweight in the community and you're reaching people that I don't know if I would have come across DPC had it not been for you. And I'm thankful for your efforts into putting this podcast together because you're changing lives by getting this information out there.
Thank you so much. That is so sweet. Oh my goodness. It makes my day. Thank you for listening to another episode of My DPC Story. If you enjoyed it, please leave a 5-star review on your favorite podcast platform. It helps others find the show. Have a question about direct primary care? Leave me a voicemail. You might hear it answered in a future episode. Follow us on socials at the handle @MyDPCStory and join DPC Didactics, our monthly deep dive into your questions and challenges. Links are at mydpcstory.com. For exclusive content you won't hear anywhere else, join our Patreon. Find the link in the show notes or search for My DPC Story on patreon.com. For DPC News on the daily, check out dpcnews.com. Until next week, this is Marielle Concepcion.